Hello everybody. In this presentation, I will be providing a brief overview on the Norton Tobacco evidence-based program. The first two slides provide an introduction to the program. This program is a smoking cessation intervention tailored towards youth, specifically 14 to 19-year-old students who are regular smokers. This intervention is conducted in high schools, but it can also be conducted in community settings. It is a voluntary program, that is, students are not forced to enroll, but they voluntarily opt into the program after they hear about it through school media, such as flyers, school announcements, etc. The intervention consists of 10-50-minute sessions where topics such as motivation, stress management, preparing to quit, etc. are discussed. The intervention is conducted over 3 months and it also includes 4 optional booster sessions after the program is concluded. This program is proven to be effective in helping high school students to quit smoking. It is known to be one of the most successful smoking cessation programs, with one review study reporting quit rates ranging from 19 to 26%. The main purpose of the NOT program is to help high school students or adolescents to quit smoking. The NOT program also aims to reduce smoking use among participants who are unable to quit. More importantly, unlike other interventions, the NOT program takes the holistic approach in smoking cessation. It also provides opportunity and resources to improve 2 other facets that might directly and indirectly impact the chances of quitting smoking. NOT helps promote healthy lifestyle behaviors including physical activity and also help improve life skills such as stress management and interpersonal skills. The key question I would like to raise for my presentation is the NOT program equally effective in helping high school students to quit smoking across all states? If not, it might be important to identify the reasons for it and modify and tailor the program accordingly, as suggested by the study. Overall, the program appears to be very effective, however, it might not have the same effectiveness across the country. For example, a study conducted in Alabama high schools, the program is relatively less effective compared to other states. Social factors have shown to be strongly associated with the likelihood of smoking cessation and thus greatly impact the effectiveness of the intervention. First such example is peer pressure. This could have a bidirectional impact on the decision to quit smoking. If there are a significant number of peer smokers in the participants' social network, it could it could negatively impact smoking cessation, whereas if the participant has fewer friends who are smokers, it could support smoking cessation. Second example is family influences. If the parents provide the necessary support in their child's efforts to quit smoking, it could play a big role in smoking cessation. The last 2 factors are examples of school level factors. The effectiveness of the NOT intervention could also depend on the type and the level of enforcement of smoking inhibition policies. The target population for the NOT program is teens and was separately delivered for both genders. The developers of the program ensured that the facilitators of the NOT program use a teen-friendly language in order to truly connect with the audience. Also, the program was delivered by same-gender facilitators. This approach was used assuming that teens are more likely to express their feelings about smoking cessation with same-gender facilitator. In addition to reach a broader set of audience, the program was also delivered in different languages such as Spanish. It is clear that tobacco is a major public health issue in the US. The NOT program, a smoking cessation intervention, was introduced with the aim of addressing this public health priority. The primary goal of this program was to help teens to quit smoking. Based on prior evaluations of the effectiveness of the NOT program, it can be said that the program has been successful in achieving this goal. Over 100,000 teens across 48 states have participated in this program since 1999, and overall 1 in 6 participants quit smoking. The NOT program has played an important role in promoting the desired change of smoking cessation. NOT program or the institutions that fund it develop and disseminates resources to help educate on this public health issue. They also create awareness among the target population around the negative impacts of smoking. The key players of the NOT program include the West Virginia Prevention Research Center and the American Lung Association. There were other partners such as school staff or school administrators, community groups, etc., closely involved in the development and implementation of the NOT program. But these two had a primary role. WVPRC were responsible for overall project management, scientific oversight, data management, and statistical analysis preparation of reports or publications, and training of facilitators. At WVPRC, Professor Dano and Professor Horn were co-developers of this program at the time of late 90s and early 2000s. ALA was responsible for commercialization of the NOT program, that is, translating the research in a way that is easy to understand and implement by the public health practitioners, and also dissemination of the NOT program. There was a high level of awareness about the need of addressing the tobacco use public health issue among the various groups involved in the NOT program. These groups had realized the need for intervening to stop smoking among teens. The NOT program became a vehicle to achieve their common goal. There were a lot of positive effects of developing this program together. They were able to form an extensive network that display cooperation amongst themselves as well as among community partners. However, there were certain situations where the opinions among the groups differed, and as a result, they had to negotiate. For example, each group had their own agenda with differing opinions towards handling the dissemination phase. With regards to the public health professionals involved, professionals representing several organizations worked together, including the local, state, and federal health departments, Department of Education, community organizations, and school personnel. External stakeholders are the individuals or organization groups outside the program, but may be affected by the program. With the help of external stakeholders, we can access broad range of knowledge about smoking among teens and also help in the recruitment, implementation, and dissemination of the program. Examples include family members, peer or friends, or private or religious organizations. Family members may support or discourage the success of the program. Similarly, peers or friends may influence your chances of stopping smoking or taking up smoking, while private or religious organizations may help in recruitment of teens into the program.